You are now tuned into the Delphin Law Info Show, hosted by attorneys from the Delphin Personal Injury Firm in Lake Charles, Louisiana. This is the show where your issues are their concerns.
Good evening, everyone, and welcome to the Delphin Law Info Show. I'm Attorney Ezra Pettis Jr. of the Delphin Law Personal Injury Firm, located right here in Lake Charles, Louisiana, 626 Broad Street, 70601, 337-439-3939. Call us with all of your personal injury needs. Today, I'm very fortunate to have as our guest Dr. Harmond of Humanity Health. Dr. Harmond, welcome to the Delphin Law Info Show.
Thank you. I appreciate you having me today.
Of course. And so Dr. Harmond has tons of letters behind her name. So she's really learned and well-versed in all areas that she's going to be talking about today. So we're excited to have her on. And what we're talking about is men's health. And before the show, her and I were having a discussion. I thought I had at least another 1 or 2, maybe even 3 years before I had to start concerning myself with such things. But she actually said I'm about 5 years late. So she's going to talk to us a little bit about that. So, Dr. Harmond, just give our listening audience a little bit of background on you and how you came to be in this position to be able to help out all the men in our community.
Okay. I am a nurse practitioner. I've been in the medical nursing field for several years, since the late 1990s. I was an RN first. Then several years later, decided to become a nurse practitioner. At that point is when I started diagnosing medical conditions and treating and prescribing medications. I have lots of experience, and my passion has always been public health. I've always worked like in outpatient communities, working in underserved areas, working in correctional facilities and places like that. I did notice a pattern as a provider treating and diagnosing patients that there was a non-compliance issue with the same population, which was usually males who wouldn't show up for their appointments, always like repetitious with males. At that time, I decided to pursue my degree in my education a little bit further to try to figure out like why. That's when I became more interested in research, got my doctorate degree to become more of an innovator, more than just like watching all these issues and these problems. And I wanted to be more of a part of the solution to see what's going on with men, black and white, but particularly the black men were even more of an issue than white men. As a wife, as a mother of 2 sons, a lot of people be like, okay, well, you're a female, how you know about men? Well, I've been around men like all my life. So, and, the life expectancy of a man is 5 years less than a woman. A black man is 7 to 8 years less than a woman. So we have to figure out why. Why is their life expectancy less? Men are half as likely to go to the doctor or complete a doctor's visit compared to women. They're more likely to be uninsured, just so many things with men. And I just was really interested in trying to see why are we having these issues with the male population?
Well, that's definitely commendable, Dr. Harmond, especially because I know firsthand everything that you're talking about. My doctor has been harassing me for at least 6 months about my yearly. And she said in the next 6 months, it's going to be time for your next yearly, So, but it's inherently has been, we typically, say we'll walk things off or we'll just, get it figured out. But really, that's not the way to go, especially like you said, for black men, when we're, disproportionately seeing some of these diseases in ourselves as opposed to our counterparts who are Caucasian.
Yes. And I do agree. My most common reason I always ask men, when is the last time you've seen a provider or a doctor? And the number one answer is like, when I was born, or I'm never sick. How do you know you're sick? Like, they have no idea. So then when we check the blood pressure is extremely elevated but in their mind, they're not sick because they feel fine. So I like to focus a whole lot on prevention and wellness instead of coming to me once you've already had a stroke and you're on 5 or 6 different medications. Let's start doing some screenings early, some preventative care. If your blood pressure is mildly elevated, okay, let's see what we can do. Maybe we could just cut back on the salt a little bit. Maybe we can lose a little weight. Maybe we can exercise a little more. There's things that we can do before medication and to prevent, further health issues that are more concerning.
Gotcha. So I guess that really, segues into the first topic that you and I want to talk about, which is health screenings, right? Those regular checkups coming in and seeing those latent issues that may not be as prevalent, right? the blood pressure, which a person can feel just fine, but you realize it's elevated.
Right.
There are preventative measures before you get to the medical, the pharmaceutical intervention. There's things that you can do to kind of help with that, right?
Exactly. I agree 100%. And then men are busy. Let's face it, they're the breadwinners, they're the head of their household. So it's kind of hard for a man to miss a whole day of work just to come to an appointment that lasts 45 minutes. When it comes to going to a doctor's appointment or taking care of their family, they're going to choose to take care of the family. So I try to look at different, avenues to try to help with that as well. I do offer telehealth. That way you can be on your job, you can be in your car, as long as you make that appointment even over the phone. We can talk about things, or on the camera we can talk about things. I do ask that you come in at least one time a year, like let me do a full head to toe physical, and after that, if everything looks good, okay, we can talk over the phone when you have issues and problems. The thing with a man, usually when they come in, something is already wrong. Something is broken, something is leaking, something is hurting, something is missing. So that's why they come. So instead of just when you have a problem, come and let's do some screening so we can prevent all those problems. Women, we get our mammograms, we get our pap smears, we do all those things just because. So I'm trying to get to the point where a man is coming just because. If a man comes in and say, oh, I'm here just to get checked out, I would feel like my job is like halfway done. That would make me feel so much better to just come and get checked out. Very, very,
That's
very.
great, and that's the hard part, though, Doc. That's the getting us in there is the hard part.
Yeah.
Because typically we'll listen. I listen when my doctor tells me, gives me a recommendation. I always listen, but like she says, a matter of getting me in there in order to be able to tell me. I'll listen. She gives me that.
And it takes a village. Yeah.
It does. It does, and it's so very important because, like you said, you rather prevent the issues as opposed to having to treat the side effects of the issue or the damage that the issue has caused.
Yes.
So just kind of give us an idea, give the listening audience and the viewing audience an idea of what is that you typically see in your office, in your practice. And of course, you're right here in Lake Charles, Louisiana. You and I kind of talked about the origin story that got you here to Southwest Louisiana, but you're very familiar with Southwest Louisiana, now Lake Charles, with you living here. But what are some of the issues that you see day to day in your practice?
Well, one of the most common, of course, is high blood pressure. That's like the number one issue. Also, obesity. Another thing that's often overlooked is mental health disorders. A lot of men deal with anxiety, stress. Fear of losing the job or getting a pay cut for the job, have to take care of the family. So all those things go hand in hand. If a man is under stress, he has anxiety, of course his blood pressure is going to be high. So let's find the underlying cause of this blood pressure. It could be hereditary, could be that you're not eating right, could be that you're not exercising, or it could be something as simple as stress. So I do really, really believe in doing mental health screenings. Like, let's screen you for depression, let's screen you for anxiety, and try to correct some of those issues because they can also affect other, long-term issues in your body. Here in Lake Charles, I also see, believe it or not, HIV. I see hepatitis C. What else do I see quite a bit? High cholesterol. All those things play hand in hand. Pre-diabetes or sometimes diabetes. So once again, there's so many things that we can do ahead of time to prevent those things. Or whenever you're borderline high blood pressure or borderline diabetes, we can go ahead and jump in and start doing some things. I actually had a man a couple of weeks ago. I thought it was kind of funny. He wasn't taking his blood pressure medicine. It's very, very high, but he told me he didn't want to become dependent on blood pressure medicine. Well, newsflash, you're already dependent on blood pressure medicine. It's, it's a part of your life for you to live. Like, you're dependent on this medication for you to live. We can't expect your blood pressure to go down overnight because some men have been living with this high blood pressure for 10, 15 years and have no clue that they were. So it's going to take a little while to get that blood pressure down. So sometimes it takes a little bit of patience and they get frustrated. So I do understand that.
Yeah,
and sexual health is another thing. Like, if I could get you in because you have erectile dysfunction, okay, well, why are you here? Because I know that's part of manhood. Let's just be honest, that's life. Sex is part of life. So if I get you in for that, okay, well, why are you here? Let's check your blood pressure and check your diabetes and check for everything else, because a lot of people don't realize that sometimes erectile dysfunction can also be from your blood pressure being out of control, not just necessarily something is wrong with your manhood.
Gotcha. Yeah, just a whole lot to unpack with that, and the common thread that I'm getting with our conversation so far, Doc, really is that that blood pressure issue that we see in the community, is a big thing, and I know that's probably statewide. We're talking about here locally, but I'm sure it's probably statewide when you factor in dietary habits that we have in Louisiana, as well as somewhat of a sedentary lifestyle. Insofar as our way of socializing is to have lunch and talk about what we're going to eat for dinner.
Exactly.
So.
Yes, that's exactly what we do. I mean, that's our form of entertainment in Louisiana, and our food is good and it's highly seasoned. So yes, we do have a lot of issues here in Louisiana. And I tell everybody, I mean, like anything in moderation is okay. Even a diabetic, you may be diabetic. I'm not gonna tell you to never eat a cookie or never have ice cream, but like you don't want to do it every single night. Like we're all human, so I don't expect anyone to be perfect, but just be mindful, of your body. One thing I like to say to get through to men to help you understand, like I know you support that men are being busy, but just think about your vehicle. That's my number one analogy I like to use. If you drive your nice truck or dually or car or whatever your toy is, I'm sure you take it for an oil change, right? At least once a year.
Have to, yep.
You have to. Why? Is anything wrong with it? Nope.
You want to make sure nothing happens.
You want to make sure nothing happens. Those tires, when those tires start like getting bald, you're not going to wait till they get completely bald or have a blowout. When they start getting, looking like they need to be changed, you're going to change them. So have that same concern about your body that you do about your vehicle and material things.
Yeah, and I think, Doc, just speaking from my own perspective, just sharing with the audience and with you, I know a lot of times as men, we also don't want anything to be wrong, right? And we feel like if we go to the doctor to find something, it's almost like it's inevitable, when the truth is it was already wrong, whatever the health issue may be. But we hope that it goes away without us having to, interrupt our lives to try to fix it. I mean, and that's prevalent because we're kind of taught that. I don't know if they're necessarily doing it nowadays. When I was young, I mean, I'm 40 now, but when I was younger, I mean, there was tons of times. I mean, we'd, playing football, playing basketball, and you hurt yourself, you want to try to finish playing and then, go see about the scrape or the bruise that you got from it, or what could possibly be, misaligned or fractured or whatever the case is, or sprained. So I think it's just more of a programming thing, like you said, as opposed to not wanting to kind of, take care of it. And, we get afraid. I mean, women are courageous in that regard for sure. I mean, for the most part, every woman that I know that I'm, acquainted with, even if something minute is wrong, they're going to go see before it turns into something big,
Exactly.
Whereas, man, we just let things snowball.
Yeah, I agree. I mean, like you just rather not know, and that doesn't make it go away. I mean, even with some men that come here, when I say your blood pressure is high, oh, it's always high. Well, that doesn't make it okay. I mean, that it's always high. Like you're a ticking time bomb. I mean, I'm sure that we all can name at least one person in our family or a friend who died suddenly, like, before their time. And we're like wondering how, and like, okay, they could have went to the doctor and known that they had high blood pressure and prevented that heart attack or prevented that massive stroke. So I'm just real big on that. And then another thing I'd like to address, I don't mean to bring race into it, but sometimes, especially with Black men, it's trust issues. I've been told that as well since I've opened this clinic. I have many men that come and say, oh, well, I come to you because I see that you're a Black provider. There's not many Black providers in the South. And so sometimes they have trust issues with other races, for some known and some unknown reasons. So to have someone that can relate to you and understand you, I'm hoping that will help a little bit better as well, as far as completing and, being more compliant with medical care.
Oh, yeah. And just in this conversation, you and I are recently acquainted, Dr. Harmond, but just in this conversation with you, I can tell you have a really good bedside manner because you care about your patients and in global, the community health, because you had mentioned earlier about the public health caveat to, what it is that you've done and gotten to this point. So I definitely commend that. That is, that is hard work, but I know it's rewarding for you, and it definitely rewards the community to have somebody like you, prevalent and present in it. So for our listening and viewing audience, we want to thank you for that compassion that you show towards your patients. And your clinic is on Kirkman Street, correct?
It's on Kirkman Street, and I'm located in Beyond Words, Beyond RX. So there actually is a pharmacy in-house. The building is owned by Lakeisha Williams, who's a medical psychologist. So there's a pharmacy here, so it's very convenient. Eventually, I'm hoping to have lab in-house as well. Right now, I do use an outside lab, but I'm able to get results like usually within a day, and we can treat the patient. If I have to do any type of injections or anything like that, the lab is right here that can be done in one location.
Gotcha. So that's 1409 Kirkman, correct?
1409 Kirkman Street, and it's on the corner of Kirkman and 6th Street.
Gotcha. Yeah, and I pass that. It's a really nice building. I pass it all the time. I'm gonna have to actually stop in now that we had you on show and schedule an appointment so that we can come over and do so. So yeah, so I'm very familiar with that. So you have a pharmacy that is on campus that's there, and I know you said and Beyond Words is there as well. I'm familiar with Beyond Words and ownership and everything there. So y'all have essentially almost a one-stop shop that you have over there. You're able to take patients, and then of course telehealth. Now, were you doing that before the pandemic, or the pandemic kind of catapult that for you guys to want to do?
No, after. Actually, I've been here about 7 months, so I'm like leasing a space in the building, like just for the men's health. So I just have a portion of the building, and so it's only like been since like the end of last year that I've been here, and started this clinic.
Oh, okay, I got you. Gotcha. Okay, well that's so great that you saw that that need for a clinic of that kind to be there. Now, do you only see? I know the name of it is Humanity. I know that's a really clever and catchy way for everybody to kind of know what it is. But do you take patients outside of men? Do you have women that come in as well for checkups?
I'm glad you caught on to that, because yes, when I said humanity, yes, I was trying to be catchy with the word man inside humanity.
Right.
Yes, I do take some women. Of course, my target population is men, because I want men to feel like they have a place they can call their own, because there are so many women's health clinics in the area. But of course, if a woman having an acute problem, if a woman has HIV, hepatitis, there's limited providers in this area that treats some of the specialized conditions. I'm one of the only ones that do. So of course, I wouldn't turn a woman around for those type of conditions. If I do have women, I do separate the women from the men, so they can still feel like they have a place of their own. I wouldn't mix the two genders together. But my target is men. But now, and hopefully eventually maybe I'll have like a Well Woman Wednesdays, because there's a need for the women in the community as well. But right now I'm trying to get these men on board.
Gotcha. Yeah, and that's a really good idea. And I will tell you, psychologically having that specialized area, just for men to go there, it does feel more of like a safe space, right?
Right.
Because we are very skittish when it comes to that sort of stuff. So that does help. Like, okay, it's just for us, just to kind of go in there. So yeah, I think that's a good thing. And for our viewing audience, our producer just put the QR code up for Dr. Harmond for y'all to scan on the screen. Our listening audience aren't able to do so, of course, but 1409 Kirkman Street, Humanity Health, Dr. Harmond, 337-502-8070, 502-8070, 337 is the area code. Anything else, Dr. Harmond, that you see and you want to kind of address our listening audience out there before they schedule an appointment with you?
Well, just to say, it's also very personal, very confidential. That number, the 337-502-8070, that's actually my phone. And that's what a lot of men, they enjoy. They can communicate with me. I answer text messages. They can call or text that number. To have one provider, not worrying about having a big facility where you don't know who you're going to get that day, it's always going to be me that's going to communicate with you, or sometimes my assistant who would get the message to me, but I am the only provider here. I just want men to be aware. Like, I don't want you to wait until the last minute. I mean, colonoscopies, years ago, age 50 was the screening age, and a lot of people don't realize it's no longer 50, it's age 45. If you have a family history of colon cancer or cancer, you want to do it even a little bit earlier. Same thing with prostate cancer. We have to screen. Most men that have prostate cancer, they don't have symptoms. So once we screen, then that's when we see, okay, you have an elevated lab level. We need to look a little bit further. Prevention. I just cannot say that enough.
Gotcha. And Doc, you said that, so whenever you have the, person come in, the first thing is to get a blood panel going and, check all of the vital signs and all of these different things, and then be able to get a plan of action if there is something that you find.
Exactly.
But step one, of course, is the initial visit coming in and then following up with you. And I know for our listening audience, Dr. Harmond accepts pretty much all major insurances, and I'm assuming the cash pay as well, right?
Yes, and thank you for saying that. I'm one of the only providers that it's hard to find people that take Medicaid as well, and so I do take most Medicaids, which is also a big issue in our area. A lot of providers won't take Medicaid, so I am taking Medicaid because I know that's a lot of our community as well. And yes, you are correct. The first visit is me getting to know you. Basically, it's doing vital signs, complete physical exam, head to toe. We order labs, and then the second visit is coming in to go over those labs. So even though your vital signs may be perfect, those labs may not be. So once we do the second visit, that's when we'll go over all your diagnostic tests. Sometimes we'll do chest X-rays, EKGs, lab work, all those things, depending on your age and what's due. But I know you were telling me about your age and that it's time, but like I say, we have to start early. I have quite a few teenagers too. I have some moms that bring their teenagers in to do STD testing. I mean, our teenagers are sexually active. I mean, we don't want to hear that, but they are. Like, we need to do screening and educate them on, HIV is out there, chlamydia, gonorrhea. Like, Louisiana is in the top 3 states of all those diseases. So there's medications to prevent HIV that people don't know about. We can give you a pill every day. We can give you a shot every 2 months to prevent HIV. Our community don't know about prevention. So I just
I've never heard. This is the first time that I am hearing of those products that are potentially out there, Doc. So you're right. The information is not as widespread, right, as it is other places. And I didn't realize Louisiana was in the top 3 of states with those particular sexually transmitted diseases.
Yes.
So
these things are covered by Medicaid. I mean, prevention for HIV, all those medications and things, they're covered by Medicaid.
Okay. Yeah, that's really good information. Good to know. And what's the normal? I say normal, but I know everybody's different. If you have a history of prostate cancer in your family, you should probably start getting screened. I guess a little bit north of 30. Is that the
Exactly.
norm nowadays?
Yes, gotcha. Around 30. But of course, if a person is symptomatic, like, if they're having issues or problems, starting their urine stream or having pain down there, just different things, then I may screen a little bit earlier. Like, you can't always put an age on everything. That's guidelines, but you still have to listen to your patients, do your assessments, and go from there. Like my he's probably going to kill me, but I have a 23-year-old who's been taking two blood pressure medicines since the age of 16. It was diagnosed during a physical exam. He was playing football. And other than that, we would have never known. I mean, me as a provider, I would have felt horrible had my child passed out on that field or something happened to him. And here I am, a medical provider, just assuming his headaches are from sinus issues. It was blood pressure at that age. So it's never too early to screen.
Oh, yeah, that's definitely important. And that's a tale of caution, cautionary tale to everybody. Because like you said, sometimes, we write things off as something else. You say, oh, well, this person's 17 years old. It can't be this, can't be that, right?
Exactly.
And we do have a habit of doing that in our community where somebody writes it off, oh, well, that person, that kid is young. He ain't feeling obese. He just, so we always do that. Exactly. And it kind of diminishes their, and then what happens is all of that's passed on. So now that kid, when he's 40, is telling his, child, you're all right, don't worry about it. That's just
exactly.
Just husky. He just husky, as opposed to trying to get him on some sort of a dietary, plan to help combat that so that he has a longer life. So
exactly.
Yeah, so I definitely agree with that. Well, ladies and gentlemen, Humanity Health, Dr. Harmond, this has been such a great and informative show. We're going to do a part 2 soon. We'll get together. We'll do a part 2. And for sure, whenever you have any sort of events or anything coming up, we'll make our listening audience know what's going on. Our producer put the QR code on it earlier, but I'll just tell everybody again, 1409 Kirkman Street, right here in Lake Charles, Louisiana. That's on Kirkman and 6 is the cross street. Is that right?
Yes, sir.
All right. And what's that phone number again, Doc?
The phone number is area code 337-502-8072. Again, you can call or text that number. If you go online, my website is humanityhealthswla.com, humanityhealthswla.com. And you can also book an appointment online from that website. I'm on Facebook, I'm on Instagram, social media. You can find me on those sites as well.
All right, so there's no excuse. You go online, book the appointment, because nowadays everything, everybody, jumps online and does things because it's just a little bit more efficient. I'm still a little bit old school. I do call, a lot of times, and
that's fine.
Most of the time when I call a place, they tell me to get online. Yeah. I'll call a place like, hey, look at that, get online.
Yeah.
So that's what I have. Yeah, but okay. Well, ladies and gentlemen, this has been the Delphin Law Info Show with me, Attorney Ezra Pettis Jr. of the Delphin Law Firm, with Dr. D'Amica Harmond of Humanity Health. Thank you so much, Dr. Harmon. We look forward to having you on the show again. We look forward to seeing you around. And please give her a call, drop by the office, make an appointment to get your health checked up, pre-screened for everything, and then we can go from there. Preventative care is the word of the day. Like it was on Sesame Street. Prevention. That's the word of the day.
Exactly. But if you already have issues, I'll take those too, and let's keep you on path, on track. But I really appreciate the opportunity. I mean, I really appreciate this. It's been nice.
Oh, well, thank you. That's so kind of you. And we really appreciate you being on Delphin Law Info Show. So again, shout out to my producer, Mr. James Chavis, who always does a great job of getting this information out to the public. So until next time, ladies and gentlemen, y'all enjoy yourselves, and we'll see you next week right here on the Delphin Law Info Show.
Thank you for tuning in to the Delphin Law Info Show. Be sure to tune in next time where we will be bringing the light to your issues and concerns.